Hello, and first of all, congratulations to all of you for starting your ophthalmology residency. Now you are having mixed feeling. You are happy from inside that you got your PG seat, and also fear and confusion regarding how will be your residency, how will be your consultants, which books to read, which instruments to buy, and so on. So many confusions. So I started this series called Let's Get You Through Ophthalmology Residency to help you go through the residency with as much as less confusion as possible. Okay. So in part 1 of this series, I'll be answering your question on which books to read during residency. And I'll be dividing this video into 6 parts. Which books to read for optics and refraction, for clinics, for practical, for ocular pharmacology, for each subspecialty, cornea, glaucoma, retina, and for surgeries. Okay. Hello, I'm Dr. Dhwani, MBBS MS Ophthalmology. I've done my retina fellowship from Shankar Netralaya, Chennai. So let's get started. For ophthalmology theory, I would say books should fulfill two main criteria. First, it should help you understand the concept thoroughly, and second one, it should help you memorize the topic so that you can write the answer in exams. Okay, and I'll be dividing this into three levels: beginners, intermediate, and advanced. What is beginners level book? So now you have started your residency in ophthalmology, but initial 2 to 3 months you will be just be figuring out which books to buy, which books to read, and all that stuff. Okay. So meanwhile, if you encounter any question, any topic you want to learn and understand, you should be having these books. Okay. And these books are our UG books, UG ophthalmology books, which we all have. Okay. Either some of us will be having ophthalmology, comprehensive ophthalmology by Dr. A.K. Khurana, or some of us might be having Parsons. Okay. So if I will tell you that comprehensive ophthalmology by Dr. A.K. Khurana is mainly in the notes format. That is very good book to write answers in exams, but that is not very good book to learn the concepts. And Parsons is good book for understanding the concept. But mind you, these books are for undergraduate level. They are not for PG level. Okay. So these books are just bridge between your UG and PG transition. Okay. You should not rely on this book to write exams in your residency. Okay. So this is the beginners level book. Now we come to intermediate, that is resident level books, which you must have. There are mainly two books. Okay. Kanski's Ophthalmology and Payman Ophthalmology. This both these books are very good to learn the concept, as well as they are in the mainly notes format, so that you can easily memorize them and write the answers in exams. Personally, I would prefer Kanski's Ophthalmology. Okay, in my opinion, Kanski's Ophthalmology book has so many pictures. It's a very good concept book, and it has very easy to understand and easy to memorize notes format. Now we'll move on to advanced level book. What is this advanced level book? So let's say you are reading any topic, conjunctivitis. Okay, so you first brush up it from Parsons. Now you are reading it from Kanski, but still you want to go deeper and understand the concept very much in depth. So you go to this advanced level book. So these advanced level books are three books mainly. Yanov. Then second one is Zia Chaudhary. It comes under 2 volume, and AO Ophthalmology, that is American Academy of Ophthalmology books. They provide books for each subspecialty: lens, cornea, glaucoma. So I would suggest you keep it in PDF format. And for this advanced level book, I will not tell you that which book to read. You just go and see by yourself which book you are understanding very thoroughly. Okay, and accordingly you decide. Okay, so so this advanced level book you not need to buy. Okay, you just keep it in a PDF format, or you can purchase it from library, and you just read whatever topic you want to read. Okay, so this advanced level book will help you understand the concept, but it is less helpful in writing answers in exam. Now for practical ophthalmology, again there are two types of book. One is conceptual book and other is factual book. Okay, conceptual book help you understand the concepts very thoroughly, and factual book help you answer the questions in Viva very thoroughly. Okay, so there are conceptual two books: Will's Eye Manual. Okay, and the second one is Namrata Sharma book. Okay, and for factual is the Arvind FAQ. So either you can purchase Will's Eye, and either you can purchase Namrata Sharma for conceptual. And for giving answers in Viva, how to answer the questions in Viva and what questions examiners can ask is the factual book Arvind FAQ. According to me, factual book Arvind FAQ is must have, and you can choose either from Bill Sai manual or Namrata Sharma for concept clearance. For optics and diffraction, there are mainly two books: Optics and Diffraction by Dr. A.K. Khurana and Dukes and Elders. If you want to learn the concepts, then Dukes and Elders is a great book. But there is one drawback is the language. Language is little bit difficult. It's easier to understand, but to write in exams, you need some factual and notes form. And that notes format will be there in Dr. A.K. Khurana Optics and Diffraction. For exams, you need Dr. A.K. Khurana Optics and Refraction, and for understanding concepts, you can read Dukes and Elder. So both of these books are must have from my side. Okay. Now fourth is ocular pharmacology, and frankly, there are very few books in ocular pharmacology, and most of us just read from here and there, from PDF and YouTube and just PPTs and all. But this book, Jimmy Bartlett, Ocular Pharmacology, is such an underrated and gold standard book for ocular pharmacology. I would suggest all of you purchase that. That will help you understand ocular pharmacology in so much easier way. It helps you understand the concept of each drugs and mechanism of action and where they are getting used. So must have from my side. Now books for ophthalmology surgery, I would say in first year you will be mainly exposed to SICS. So SICS, Dr. KPS Malik and Ruchi Goel book is good. Okay. And for FACO, book by Dr. Harbansh Lal is great book. The language is easier, so many pictures, and that book makes you go with the flow. So must buy FACO by Dr. Harbansh Lal. And for overall ophthalmology surgery, there is a book by Dr. Sandeep Saxena. Okay. And personally, I feel for surgery, YouTube videos are a great source of learning rather than books. Okay. You can just learn from YouTube videos, surgeries. Now, books for each subspecialty. These are the books that it's good if you read them, but you are not expected to read during your residency. But if you have keen interest in any particular subspecialty and if you want to learn any topic in great detail, then these books are great. Okay. So first of all, for retina, Ryan's Retina now is the seventh edition, is the must-have and gold standard book for retina. For neuro-ophthalmology is Will's Neuro-Ophthalmology Atlas, okay, and for cornea is the Crackmer. For glaucoma is the Shield, but I would say Shield is very detailed and there are lot of studies involved in shields, okay. And for uvea also, Will's uveitis book is there. And the most asked question is which book to read for squint. Personally, I have read Kithlai book, okay, for squint, and there is one book for squint by Dr. Pradeep Sharma. That is also very good book. If you read it. For lens, you can read it from AO Ophthalmology Lens module. They have it in very great detail, okay, each and every aspect of lens, anatomy, embryology, and surgical aspect also they have covered in very much great detail about lens, okay. So for lens, AO Ophthalmology Lens module. And for oculoplasty, there is a book by Dr. Jeffrey Nerett. That book is also very good book to learn oculoplasty. I have provided names of all the books in description below. Now you know the names of all the books, and you also might be having some books with you. But again, question arises when to read, because honestly, it's very hard to read and learn ophthalmology during your first year of residency, isn't it? Because so many things are happening around you. You have ward calls, emergency duties, paperwork, and you are foreign to the environment, and you are just blank, nothing. Okay, so in next video of this series, let's get you through ophthalmology residency. I'll be sharing with you some tips on how to stay sane during your residency. So see you there. Till then, bye bye.